Hello and welcome to my channel. I'm particularly excited today because I am joined by my aesthetic doctor. This is Dr Sarah Tonks, who you might remember from a video I put up about a year ago now, when she put 2 millilitres of filler into my top lip. And I've got her today because recently I was in Monte Carlo talking to a group of people about the importance of trust in your practitioner. And that means that you need to do your research before you have any injectables at all. And it really worries me that day by day I get asked questions by people. They slide into my DM either on Instagram or on YouTube, and they say to me, how do I find the best person to give me any aesthetic procedure? So I thought, who better to ask than the person that does a lot of my aesthetic work. Proof that you can look natural and have work done, but also I wanted to get an expert in to ask her the questions on your behalf. Welcome.
Thank you. Thanks for having me.
My absolute pleasure. Now, what I wanted to do was I wanted to go through the process of finding a good aesthetic practitioner, what you should ask when you're going for your consultation, because I think so many people are frightened to ask questions of their doctors, and then how to get the most out of any procedure you might have, and you're the expert. Yeah?
Awesome.
Okay, now I know that you and I have done this many times, but we kind of got to go back to the very first time I ever came in to see you. What should you expect when you go in and have a consultation for the first time if you've never had any work done at all?
Well, I think the first thing is we need to figure out what it is that you're wanting from the consultation and from any potential procedure that you might have. So you've really got to be on the same wavelength, I think, as your practitioner, and make sure that they really understand what it is that you're looking for. The second thing that I would really suggest that people do is it's good if you can take pictures, because then you can be objective together about what it is that you're looking at.
So pictures of yourself when you were younger? That's what I always do. I always take pictures of me 20 years ago, and can you make me look like that?
That's actually a really good point. It's very helpful if people do bring in pictures from when they were younger, because then it gives us an idea of what's natural for them.
So you're saying pictures of yourself, not pictures of a celebrity?
I prefer it if people don't bring in a picture of a celebrity, but in some ways it can be useful, because what's natural to one person might not be natural to another person. So it gets a ballpark idea,
okay.
I think.
And I think it's really, it's so difficult to look at your face in an objective manner. And I think sometimes, like when I come to see you, you always take a picture of me. One, to track my progress, but also because you don't look at your face objectively in a standard light, do you?
No, the lighting's different. Often the mirror that you'll have is either a magnifying mirror, and then it distorts the image, and people only see themselves from the front. Other people don't look at you like that. They look at you like we're looking at each other now, from the side angle like this, and all the way around, of course. And also it's important to see how you look when you're moving your face, when you're happy, when you're sad, when you're talking. And you don't really do that if you're kind of being critical of yourself in the mirror.
Okay. I know that you're a properly medically trained doctor, which is why I put my trust in you. Who really, in your opinion, should be doing aesthetic procedures?
It's a great question. In my personal opinion, I'd like to see doctors, dentists and nurses performing these procedures, people who have a medical background.
Okay. And I think in our culture it's quite difficult for most people to question a doctor, because most of the time we're sitting there getting, health and well-being advice from a doctor that might be completely not aesthetically related. Is it okay to ask your doctor what qualifications they have and how often they do a procedure?
Of course, absolutely. I think I'm quite fortunate where I work that I get loads of questions every single day, and I love answering those questions because it helps me to further understand what it is that the patient wants from me. Don't be scared to ask your doctor about whether or not that procedure is right for you, or how many of that particular procedure they've done before, or anything like that. They shouldn't be intimidated by you asking them. It's a two-way process.
So this is exactly what a consultation should be. It should be building that trust between your chosen aesthetic medical practitioner and you.
Yeah.
Should you ask what product is being injected into you? Because quite often people say to me, I've had a really bad reaction, or I don't like the way my lips have turned out, and I always say, can I ask you what you've had injected into your face? And they go, I don't know, I didn't ask.
Yeah, I find it crazy when people don't ask what is being put into them. It's insane.
So is it okay to write down and say, can I just ask before you do my lips, or before you do
Sure, of course.
my cheek, or before you do my forehead?
Yeah.
Can I ask exactly what you're using and how much you're using?
Yeah, they'll know more about their shade of foundation than they will about what's been injected inside their skin.
It's so true. It's so true. And also I think it's not that, I mean, hopefully that you will build a long-term relationship with whoever's working on your face. But I also think if you then decide to go to another practitioner, they will need to know your history. So you almost have to take your own little mini medical history, don't you?
Yeah, it's super helpful.
It makes you sound really difficult, but I actually think a really, really confident doctor like Sarah is confident and capable, and they're not ever threatened by any questions you ask.
I love it when people know exactly what it is that they've had done before,
Yeah.
because it's helpful for me, because then I don't worry. What if they've done something unusual
Yes.
before they've seen me?
Yes.
Because that will change how I would, my treatment plan for them.
Yes. Do people ask about side effects? I think it's really important to ask about side effects, and I think it's really important to ask about downtime. I know that I bruise quite easily and I swell quite easily because I've got a typical histamine reaction. What would you say to people?
Wow. I always say to them, you've asked me a very hard question when they ask me about downtime.
How long is a piece of string?
Yeah, exactly, because it depends on which area it is that you've injected, exactly which product it is that you put in, and of course your physiology, so your nature. Also, people's idea of downtime is quite different. So, you know, whereas someone like maybe myself, I don't really mind if I go out with a little bit of swelling. Other people are much more cautious, and if they have a small amount of swelling, it's a big deal to them, which I understand.
So the important thing again is just ask and have your questions answered.
Yeah.
Okay. Do people ask about what to expect in terms of discomfort and pain? Because that tends to be the question that people ask me most often about anything is, how much does it cost? That's another question we need to ask. And how painful should it be?
How much does it cost is the truly painful part. So
good answer.
I always say it's for me, when I have it done, I find it uncomfortable but not particularly painful, and there are lots of little tips and tricks that we can use during the treatment process to help to ease that discomfort. So for example, you know, you've been in aesthetic medicine for a long time, so you'll know that a lot of the old products, they didn't contain anything to help numb the skin up, for example.
An anaesthetic in them straight away, yes.
Exactly, yeah. And now,
I always say, when I look back at that video of you doing my lips, it looked worse than it felt.
absolutely.
It always looks worse than it feels.
does.
Always.
It does. It looks pretty grim, but actually, on being on the receiving end,
It's not that bad.
no, it's fine, because often you don't really feel too much, do you?
No. We feel a little bit.
Yeah, a little bit.
Should everybody, when you book your initial appointment and you have your treatment, also have a follow-up appointment or treatment included in that plan?
I think it's great to have the option to do that.
Okay.
So what really upsets me is when I hear stories of people who have had a problem or had an issue
And haven't come back to you.
they haven't come back. Yeah. So everybody can always come back after they've had a treatment. Sometimes we do it as a matter of course, if I'm concerned about something or I think that we need to do a little something extra. Other times, say if they're traveling and they're not able to come back easily, sometimes I'll just get them to email some pictures in or chat to someone on the phone, for example. But you do hear stories of people whose practitioners have kind of washed their hands of them.
Yeah, one treatment and you're out. That's
Yeah.
that scary sort of back of a magazine, buy one, get one free treatment.
Yeah.
If you're buying into that mentality, you're probably not going to get the level of care and service
No,
that
and
you expect.
That worries me.
Talking of money, at what point should you be asking how much things cost? Because honestly, hand on heart, sometimes you don't know till you swipe your credit card.
That's true.
Is it because we don't like to talk about money? Because I think it would be good for somebody to say to you, this is my budget, could you stick within that budget, and what are my viable options?
Well, I always ask if there's a budget that we need to be respectful of during the consultation process. That's
if
part
a
of
doctor
that.
doesn't say that though, is
Yeah.
it okay for the patient to say that?
Of course, you have to
You
know.
see, I think we're just frightened of talking about money and talking and asking questions of doctors is cultural, isn't it?
And do you know why as well? I think it's because at medical school, money is not touched on. It's a bit of an icky subject.
We have the NHS in the UK, so in America it's fundamentally different. When you speak to American people, they go, well, of course I ask how much because I pay for every medical, whereas we don't. We have most of our medical treatment for free, so nobody talks about how much things cost.
That's right.
Yeah. I think it's you almost need to be a little bit of a thorn in a doctor's side to be a really good patient. Or maybe that's just me, I don't know.
Who said you were a good patient?
One of the most common misconceptions I get levelled at me is, but you believe in skincare, so why do you need injectables? Can we talk about how they are not at odds? They are totally complementary.
Of course, they're completely complementary. They go hand in hand.
Because you're as passionate about skincare as I am. We compare notes the whole time.
They're really complementary treatments. So if you've got good skin, why can't you have injectables? They do completely different things.
I always say this, and I'm not sure if anybody agrees, but I always liken it to making the perfect hotel bed. You know, when you go into a hotel and the bed's perfect. And I always think of skincare as being investing in 1,000 thread count, really beautiful duvet cover and duvet. So that's where your skincare goes, the very surface layers. But sometimes you just need a new mattress. Because injectables are going into that level.
Yeah.
They're going so much further than your skincare. But also you wouldn't have a brand new mattress with a tatty old duvet.
Yeah.
And you wouldn't have a brand new duvet without a really nice mattress. The two are so synergistic to me.
Absolutely.
I don't see why they're in conflict at all.
Yeah, absolutely. In fact, if you think about it, skincare, if you're looking at it in a pyramid form of procedures that people have, should be the base of the pyramid. So it's the foundation of everything that I do is good skin, and then above that then you'll have injectable procedures, and then above that at the top of the pyramid you'll have things like surgical options.
And then finally I want to ask the question, and this is actually not something you would discuss with your doctor, but I think it's really important for us to discuss it here and now. You and I are both really honest and open about the work we've had done. People are often surprised that I've had work done, and I've had a little bit of work over the years for the last 12 years because I want a really natural look and I want a face that's really expressive. Why are people so judgmental, and why is there so much stigma attached to having any aesthetic work done?
I think that's an amazing question, and we had a bit of a chat about that before we came on camera, didn't we? Personally, I don't really understand why it is that other people feel like they have the right to judge the decisions of someone else. Whether or not there's a bit of, I don't know, maybe jealousy behind it because they want to have the procedure done and, you know, they're either too scared to do it themselves. But don't you think we live in a bit of a judgmental society right now?
Absolutely. I also think it's cultural as well, because I think if you go to America or you go to Brazil, for example, there's much more an acceptance of the fact that if you were going to invest in the way you look, it's as important as investing in your health or your well-being or exercising or paying for a course of Pilates. Yeah. And I think sometimes, I think you called it Calvinistic, and I love that. That's that slightly sort of Northern European stoic mentality that we should just brave on through.
Yeah, soldier on.
Yeah, absolutely. What do you say to people who, you obviously have patients that want to keep their treatments a secret. Yeah. Not everybody is like you and I. You and I are more about opening a discussion and being honest about the treatments we've had. Do you also respect people's desire to keep it? Because I mean,
of course.
She knows a lot of celebrities as well. They all keep it a secret.
Of course, but I would really love it if people would just be honest and come out and say, look, this is what I've had done. I don't have special celebrity genes. You know, I'm not 60 and look 40 because I drink water, 2 litres of it every day, and I do Pilates. There are little tiny tweaks that all these people have done to get them looking so amazing later in life, and I think often the general public doesn't realise that, and then it makes people feel bad about themselves. I don't look like that.
I also think it's a way, because I come from a background of working on weekly magazines and newspapers, I also think the way it's scandalised in newspapers and magazines.
Yeah.
I think one of the most important things to say is to everybody is the only reason that aesthetic work gets such bad press is because you only see bad aesthetic work. You don't see good aesthetic work unless somebody admits that they've had it done. That's the truth, isn't it?
There's this horrible you're damned if you do and you're damned if you don't situation.
Yeah.
So, you know, when they circle the cellulite that a lady has in a magazine, and then 2 minutes later there'll be another page on loving yourself, it just doesn't make any sense.
Yeah.
What are we supposed to believe?
I think the important thing is that people like you and I have an open discussion like this. And what I will do is I will tag Sarah and Sarah's feed onto this. So you can go into her DMs and ask her all the questions, because what's good about Sarah is she does answer every single question. So we'll tag you on Instagram at
The Lovely Clinic.
Okay,
Yeah.
which is TLC, by the way. And also I'll tag you on YouTube here so that you can go in, and you obviously can ask questions. I always encourage you to ask as many questions as possible. I'm really honest and open about the work I have done, and I do have little and often, because I want my face to be completely flexible and to move really naturally. But also, if you've got really technical questions, I think it's really important that you ask a properly medically trained professional. That's the secret. It really is. There are so many clinics on Instagram or in back of magazines doing buy one get one free, and I always think that it's a long-term relationship with somebody who you really trust, and that's built from the minute that you meet them. Thank you for joining me today. I will put all of Sarah's credits in below, and she will, I promise,
Yeah.
I'm holding her to this, answer all of your questions. Thank you for watching, thank you for subscribing. Any questions, please ask below, but also you can now ask the doctor.